Welcome, everyone. Thank you for joining us today for our Novo Nordisk Network for Healthy Populations seminar series. Today, I'm delighted to welcome you to the seminar on Tingbjerg Changing Diabetes. And before I introduce our speaker, I would just like to start with a land acknowledgement. So we'd like to acknowledge that the land on which the region of Peel operates is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabe, the Huron-Wendat, the Haudenosaunee, and the Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have the opportunity to work on this land, and by doing so, give our respect to its first inhabitants. We are all treaty people, and many of us have come here as settlers, immigrants, or newcomers in this generation or generations past. So we'd also like to acknowledge those of us who came here forcibly, particularly as a result of the transatlantic slave trade, and pay tribute to the ancestors of African origin and descent. So, welcome once again, everyone, and thank you for attending today's Network for Healthy Populations seminar, Tingbjerg Changing Diabetes, presented by Paul Bloch, who is speaking to us from the Steno Diabetes Center in Copenhagen, Denmark, and we are delighted that he was able to join us today. Before I introduce you to Paul, I'd like to quickly review some housekeeping notes. We appreciate our audience muting themselves during today's presentation. There will be an opportunity for questions at the end of today's session, and we will be inviting questions both through the chat box or by using the raise hand function. If you have questions during the event that you would like the speaker to address at the end of the session, please enter them in the chat box and I'll try to get to as many as possible. Lastly, please note that today's session is being recorded and we will make the recording available on the network's website for those of you who'd like to see it again or who are unable to join us today. Now I'd like to introduce our speaker for today. Paul Bloch is a senior public health advisor and researcher with more than 30 years of international experience in community development, disease control, and operational research. He holds a master's degree in biology, a PhD degree in epidemiology, and a diploma in public health. His professional focus is on research-based development with an emphasis on health promotion research, health systems research, and community-based participatory research. Paul Bloch works as a senior researcher and team leader for prevention research at the Steno Diabetes Center in Copenhagen, which is in the capital region of Denmark. He is currently involved in interdisciplinary research and development around complex interventions and mobilization of community-based stakeholders and their resources for promotion of social development and healthy living. So without further ado, I'd like to ask you to join me in welcoming Paul Bloch to present his talk today. Thank you, Paul.
Yeah, thank you so much, Lorraine, for this introduction, and thank you so much for allowing me to speak in this network. It is a very great pleasure, and I'm very honored about this. What I will do now is that I will share my screen, and then I will start my presentation. So can you see the slide, Lorraine?
Yeah, you can see them, Paul. It looks great.
Yeah, thank you so much. Yeah, that is correct. I am a senior researcher working with health promotion and disease prevention at Steno Diabetes Center Copenhagen. And Steno is a public hospital under the capital region of Denmark. It is specialized in diabetes care, research, education, prevention, and health promotion. It is also a global partner in the Cities Changing Diabetes program and a local partner in Cities Changing Diabetes Copenhagen. At Steno, we recognize the importance of the social determinants of health and the need to address these determinants to achieve sustainable health outcomes. This implies acting at all levels, from individual to interpersonal, organizational, community, and society. We recognize that complex interventions to prevention of obesity and diabetes are the most effective, and that the settings of everyday life offer excellent opportunities for reaching out to citizens respectfully and equitably. We have developed the supersetting approach to mobilize local communities for public health action based on coordinated engagement of multiple stakeholders in multiple community settings. This supersetting approach embodies 5 principles. The principle of integration to ensure that activities are implemented across the boundaries of specific settings. The principle of participation to ensure that people are motivated to take ownership of processes of developing and implementing activities. The principle of empowerment to ensure that people acquire skills and competences to express and act on their needs and aspirations. The principle of context to ensure that everyday life challenges of citizens and professionals are respected and considered in the planning of activities. And finally, the principle of knowledge to ensure that scientific knowledge is produced from actions and used to inform actions. To promote sustainability of actions, we strive to optimize vertical and horizontal integration of our interventions. Vertical integration secures commitment at all levels within each partner organization. Horizontal integration secures a productive working relationship between partner organizations by negotiating the terms of engagement and by matching expectations of partners. At Steno, we acknowledge the need for long-term and sustained change processes, and we therefore work in iterative cycles of implementing, assessing, and improving actions. We have developed the community action research model as a methodological framework for action. All right, Tingbjerg Changing Diabetes provides a fine example of how we work and work together as partners in Steno Changing Diabetes Copenhagen. Tingbjerg is an urban neighborhood situated in the outskirts of Copenhagen, about 8 kilometers away from the city center. It is a high-risk area for diabetes and has a prevalence of type 2 diabetes of almost 10% within the adult population. This is double the average for the whole of Copenhagen. It's a disadvantaged neighborhood in terms of social challenges with relatively low levels of occupation, education, income, and so forth. Tingbjerg Changing Diabetes is a long-term strategic engagement in community development, organized around a wide and dynamic partnership of professional stakeholders from the public sector, the private sector, civil society, and academia. It is a community-based initiative embracing the entire neighborhood, including its various population groups, professional stakeholders, organizations, institutions, enterprises, settings, etc. We involve professional stakeholders and citizens in 3 overall processes of engagement, namely co-analyzing the situation, co-creating interventions, and co-evaluating actions. They are not involved to save time or money. They are involved as the rightful owners of processes of developing and implementing change in their own neighborhood. I'll go through each of these 3 steps now. In terms of co-analyzing the situation, we have developed and applied the local community analysis tool to map, describe, and understand how the neighborhood is structured, who lives there, who work there, and what residents and professional stakeholders think about the neighborhood in terms of its strength, challenges, and opportunities. This is organized around 4 domains, namely mapping the structures of the community, both physical and organizational, objectively describing the characteristics of residents living in the neighborhood, presenting the perceptions of professional stakeholders working in the community, and 4, presenting the perceptions of residents living in the community. Okay, step 2, in terms of co-creating interventions, we work together with people to identify, develop, and implement solutions to local challenges and needs. At Steno, we have developed a variety of specific tools and techniques for respectfully engaging in dialogue with people, whether they are civilians or professionals, healthy or diseased, socially strong or vulnerable. You may apply these tools to create interventions, but you don't need to. You need to listen, to be open-minded and constructively responsive. When looking back in time at our engagement in Tingbjerg, we have noted 2 factors that are particularly important for establishing a conducive environment for collective action and change, or proper spaces of participation, as we call it. And these factors are structure and equality, 2 somewhat contrasting factors, and yet factors that are mutually dependent, where one cannot do without the other, and where the key to success may be to find a proper balance between exercising control and letting go of control. Okay, step 3, in terms of co-evaluating actions, we involve residents of the neighborhood, youth groups, as well as adults, in processes of designing evaluation approaches, collecting and managing data, and disseminating the findings in the neighborhood. This provides citizens with influence on what should be evaluated and how it should be done. This supersetting is maintained and expanded over time in size and scope. This is the only way to achieve desired outcomes on social determinants and health. Maintenance and expansion are dynamic processes based on engaging with new partners, on generating new ideas and developing new projects together. This slide shows the various projects that we have implemented and projects that we are in the process of implementing. We are currently preparing for projects on promoting occupation and entrepreneurship, on strengthening the bonding between children and parents through outdoor playing, and on developing a sustainable neighborhood through various community recycling initiatives. We have managed to sustain operations over a long period of time, and we've realized quite recently that the nature of sustainability is not financial, but relational. It is the dynamics and resilience of trusting partnerships that keep the wheels running, and not fixed budgets or continuous flows of funds. Tingbjerg Changing Diabetes involves 4 different evaluation domains: perceptions and attitudes, which provides subjective and qualitative data from citizens and other stakeholders; behaviors and practices, which provides both subjective and objective quantitative data from citizens; social economy and health, which provides objective, quantitative, and population-based data on citizens from national registers; and finally, biomedical and clinical measures, which provides important objective and quantitative data based on individual clinical examinations, blood sampling, and the like. On behaviors and practices, a good example is our measurement of social capital, based on Robert Putnam's bonding, bridging, linking model. This is carried out every 2 years as a household-based survey involving residents in designing, organizing, and implementing the survey. This slide provides an example of the significance of our findings from these surveys. To a question about whether residents had good friends in Tingbjerg. 2 out of 3 respondents agreed or highly agreed. This is an indication of high cognitive social capital. However, to a question about how often residents participated in social events together with family or friends, 2 out of 3 rarely or never participated in such events. This is an indication of low structural social capital. On this basis, the notion that residents of Tingbjerg have good friends in the neighborhood, but rarely participate in social events, has proven highly valuable in the planning of social activities and events in the community. Okay, and on social economy and health, a good example is our very preliminary analysis of data from national statistics registers, showing an apparent rapid reduction in the prevalence of type 2 diabetes among adults over the past 2 to 3 years, following a long-term rise since 2003. The blue line is Tingbjerg, and the orange line is the average for Denmark. So let me end this presentation by giving you 5 tips for how to get started with similar initiatives elsewhere. 1, work through partnerships with stakeholders from different sectors and professions, pool your resources, and accept power sharing. 2, agree on visions and principles for action in order to keep direction and coherence of your intervention as the initiative grows bigger and wider. 3, understand your community, including its various population groups and their challenges, needs, and aspirations. 4, work with people, not for people. Empower them and give them influence and ownership. And 5, start small scale with few but dedicated partners and projects. Pick the low-hanging fruits and slowly build up the initiative. And finally, as one of our local partners said one day, with sustained financial cuts to social development schemes in deprived neighborhoods, this may be the preferred collaborative model of the future. I urge you to go and visit our website, tingbjergchangingdiabetes.dk, because there are a substantial amount of resources there, including papers and methodologies and descriptions of the various projects and so forth. So please go and visit this one. And then lastly, I still have a couple of minutes left of my airtime. So what I'm going to do now is to show you a short video from Tingbjerg, to give you a first-hand account of how we work there, not only coming from my mouth, but also from some of our partners' mouth. So what I'll do now is that I will start this video. Is it better?
Yes, it sounds great, Paul.
Vi er i Tingbjerg, der er et socialt udsat boligområde, der ligger nordvest for København. At det er socialt udsat vil sige, at der er en lavere uddannelsesniveau og også lavere indkomstniveau end gennemsnittet. Vi ved også, at der er en højere forekomst af type 2 diabetes i lokalområdet, end hvis man sammenligner det med landsgennemsnittet. Men der er også herude et væld af mangfoldigheder og ressourcer blandt beboerne.
Tingbjerg Changing Diabetes er et langsigtet indsats, der fremmer sundheden og forebygger diabetes midt i bydelen Tingbjerg i det ydre København, hvor folk lever og bor. Her er forekomsten af diabetes blandt voksne ca. 10%, hvilket er dobbelt så meget som i resten af København. At sundhed skabes igennem hverdagslivet har vi vidst igennem rigtig mange år. Vi har også vidst, at en sund og aktiv livsstil med masser af bevægelse, alsidig kost og socialt samvær er med til at fremme sundheden og forlænge livet. Alligevel har vi som borgere og som samfund været dårlige til at omsætte denne viden til praktisk handling. I Tingbjerg forsøger vi nu at gøre noget ved det. Indsatsen gennemføres i et partnerskab imellem sociale og sundhedsfaglige aktører fra den offentlige sektor, den private sektor, det civile samfund og forskningsmiljøet.
I partnerskabet har vi forskellige aktiviteter, hvor det er helt centralt, at borgerne er involveret.
godt stå lidt tættere end dem der, men ikke for tæt.
I fælleshaven kan man komme ned og få et havelod og være med til at organisere sig omkring dem.
Det vi dyrker her i haven er jo grøntsager og krydderier, både til lejlighederne og til restauranten, men det er også fællesskab. Det er også et mødested for beboerne, hvor de kommer ud af lejligheden og har noget, de holder af på en fælles grund, på en fælles jord. Og det skaber relationer, det skaber netværk, og det skaber ejerskab til den bydel, folk bor i.
I restaurant Virketrang kan man komme ned i et trygt, dejligt rum og være med til at udfolde sine kompetencer, når det handler om madlavning.
Restaurant Virketrang, som vi driver herude i Tingbjerg, der skaber vi helt klart et socialt fællesskab, som er dejligt afvæbnende, fordi at den madfællesskab, der kan vi afprøve alverdens madkultur, og vi kan grine og smile og hygge os sammen.
Nu måler vi det, og så skal jeg nok forklare dig, hvad det betyder, det vi måler.
I sundhedsfeltet har Center for Diabetes en fremskudt indsats, og det er vigtigt, fordi at der kan være nogle borgere, der ikke er så mobile, og så giver det rigtig god mening at placere indsatsen tæt på, hvor de bor.
I sundhedsfeltet, der kan man komme og få en snak om det sunde liv. Har du diabetes, eller er du i risiko for at udvikle diabetes? Vi er meget tæt i nærområdet, der hvor folk bor, der hvor livet foregår med diabetes eller risiko for at have diabetes. Så det skaber en tryghed og et helt unikt samarbejde.
Vi er efterhånden kommet langt i forståelsen af, hvad der virker og ikke virker i forhold til at fremme sundhed og forebygge diabetes. Det virker, når man arbejder tæt sammen på tværs af fagområder og udviser kollektiv vilje til at ofre noget af ens egen rådighed til fordel for et højere mål. Det virker, når man skaber og bygger trygge og rare arenaer i lokalsamfundet, hvor borgerne har lyst til at komme og være sammen med hinanden. Og det virker, når man investerer tid i at opbygge relationer til borgere og aktører, og dermed sikre, at aktiviteter kan skabes og implementeres på et tillidsbaseret grundlag. Vi er nu i fuld gang med at promovere vores indsats i andre bydele af København, i andre byer i Danmark og i andre lande i verden gennem det globale Tingbjerg Changing Diabetes program. Vores ambition er at nå ud med vores erfaringer og vores viden til en lang række byer og lande i verden, og etablere og styrke samarbejdet på tværs, således at vi kan nå nogle højere mål, end hvad vi har set før.
So thank you so much. That was all I had to say, and then I hope that we will have a good discussion.
Paul, thank you so much for that inspiring presentation and for all your amazing work you've done in that neighborhood in Copenhagen. I'm sure people have questions, so please, if anyone has a question, either use the raise hand function or put your question in the chat. And while I'm waiting for people, maybe I can ask you a question. So Paul, I guess it was very interesting to see that even in the kind of relatively short period of time that there may have been a change in diabetes prevalence. I also saw that for Denmark as a whole. Are you able to estimate the extent to which the changes in that particular neighborhood have contributed to those changes?
And this is a key question. I can tell you that it was only, we worked hard over the past at least 12 months to get access to national statistics data, because the community, which covers around 7,000 citizens, is relatively small for the national statistics to release person-specific data. And therefore, we've had a lot of negotiations with them, but we have succeeded. And we have now had access for the first time dating back to 2003. And we have numerous variables to work with now. But I can tell you, Lorraine, that it was only yesterday that I had this graph presented, I told or asked one of our statisticians if he could, for this presentation, quickly, without too many sophisticated analysis, come up with some initial ideas or hints as to how type 2 has developed over the years. So what I would normally say is that it is not our purpose to explain and establish cause-effect relationships as far as our intervention is concerned, because we acknowledge that this is very, very complex and that a multitude of factors will contribute to the change processes. So, I cannot promise or guarantee that it is because of our interventions that we have seen this change that appears to be pretty dramatic. But we hope so. I can tell you another thing is that we've also recently had data that income levels have increased in the community. And this is an example of how we work with socioeconomic interventions, because we are also having a close relationship with the job center and other private enterprises and securing various kind of jobs to people. And they're seeing that we, at the same time as we see a decline in type 2 prevalence, we also see an increase in income levels, points to the same direction. And there will be, in the future, other parameters analyzed by us so we can see if it goes up and down. But so far, we've only seen positive tendencies as far as positive impacts in socioeconomic and health parameters since we established our interventions back in 2015 and embarked on our collaboration. So that was a very long answer to your question, but I cannot say explicitly that it is due to our intervention that this declines.
Well, and that's completely understandable. And in fact, I was even surprised that you were able to show that kind of data. So yeah, thank you for bringing it forward to us on such short notice. There are a couple of questions in the chat. I'm going to start with Catherine Whiteside. She's asking, how are you developing relationships and partnerships with primary care?
That is an extremely difficult task, I must say. And with primary care, well, no, that's not a big task, but the big task is to establish a relationship with general practitioners and private medical practitioners, which is the way that the Danish healthcare system is organized. We have municipality services, health services, mainly related to rehabilitation. And then we have hospital sector, which is the regions where I work. And then we have the general practitioners that work privately. And typically in the Danish healthcare context, the big challenge is to establish collaboration with general practitioners because they work privately and insist on being paid no matter what kind of additional assignments and tasks are needed. So this has been a situation for many years, for decades, and it still is a problem. However, with the general practitioners in Tingbjerg, they are not similar to general practitioners in most other places in Denmark, because they are typically general practitioners in this kind of disadvantaged communities because they also have a strong ideology and they really want to do something for the community. And this also applies to Tingbjerg. So we actually have a pretty good relationship with the general practitioners there. It can still be improved and we are still working on it. You may notice that we had one project that is called EDIT, Integrated Diabetes Intervention in Tingbjerg, and this project is one of our projects. This project is now, it has been up running for a bit more than a year, and here general practitioners are important stakeholder groups, and therefore we are in dialogue and working with them on being part of the integrated diabetes intervention. You should know, though, that in the municipality it's not a problem at all. We've been working with the health department in the municipality of Copenhagen for many years, and they are friends of us, and they are deeply involved in our engagement in Tingbjerg. So the key challenge here is general practitioners, and that's quite typical in the Danish context. Yeah.
Mm-hmm. Yeah, I can imagine. And I guess your integrated program, is that the one where, you have nurses doing screening and diagnosis of diabetes, and then they get, they become connected with the local practitioners?
Yeah, you saw it in the video. You saw Johanna, and she is a diabetes nurse who who is posted in Tingbjerg by the municipality of Copenhagen and the Department of Health. And the Department of Health is a partner, an integrated partner in our project called Integrated Diabetes Intervention in Tingbjerg. So this is very obvious. There's not a problem in that one as well. They have this extended services, no, outreach services in Tingbjerg as a part of the department's interest and engagement in cities changing diabetes Copenhagen. And we benefit a lot from that, of course.
Mm-hmm. Great, thanks. Catherine, did that answer your question?
Yes, thanks very much.
The next question is around maybe expanding on what you had briefly touched upon regarding evaluation, was around what are some of the other short-term measures that you're using to evaluate the program, because of course diabetes is such a long-term outcome.
Yeah, actually, and you know, I mean, we've been there since 2015, and we've not really been very interested in diabetes, as a matter of fact. I know I shouldn't say this to my boss because I'm working at Steno Diabetes Center, but as a matter of fact, we believe strongly and sincerely that prevention and health promotion must be rooted in the social determinants. I mean, we are serious, we mean it. And it comes, especially since Michael Marmot's Commission on Social Determinants of Health in 2007, that we were really dedicated and convinced that you need to go outside the health sector to change health in populations. And there is no sector which is not relevant. I think the least relevant is the health sector. I think all the other sectors are extremely relevant. So we've not really sort of catered so much for or asked diabetes-specific questions. It's only now that we have a project that is called Integrated Diabetes Interventions in Tingbjerg that we've started looking at these kind of data, and we are happy about that. We are ready to talk about diabetes now. We have not been ready for the past 7-8 years. We've not. We are ready now. So we've been much more interested in all other kinds of measures, and each and every project has its own monitoring and evaluation plan. So we have documented a variety of different important impacts as far as partnership, collaboration, intergenerational issues, the relational aspects of working community-wide across age and sex, age and genders. So we have a variety of important findings there, which contributes to our model, our supersetting model, talking about the importance of working together across the boundaries of all kinds of sectors and professions. So our interest, and you can find this on the website of tingbjerg because there are references to all our publications, both popular as well as scientific publications. And this has been the main priority for us, that is to try to challenge ourselves as to whether this model is the right model and whether it can do what it is supposed to do, namely bringing partners together and bringing citizens together across different population groups. And this has turned out to be highly successful. And that is what I tried to explain in my presentation, that this issue, we call it spaces of participation. We've worked with it scientifically. And the spaces of participation is comprised of 3 different components, namely the physical aspects, the organizational aspects, and the social aspects. And it has been extremely important learnings for us to understand that spaces of participation where people can freely speak or just be present in a room are fundamental to establish relations to people, also between people, not only between professionals, but also between people, between population groups that normally don't meet and engage. And these are the kind of questions that we have asked and answers that we have been given. So I totally agree that that diabetes only comes after many years, and we can also see that from this graph that I showed you. But it has not been our key interest, really. It has been these much more relational and organizational issues that we have addressed. And here we are on pretty safe ground. We know that we are on the right track. Whether it will also hold for the diabetes prevalence and whether it will continue declining, only time will show.
Right, but it sounds like with respect to the question around short-term outcomes, it's all of those kind of determinants of health, the social and perspective related factors that are being measured as those kind of predisposing or intermediary factors that would ultimately be linked to diabetes. And you're looking at behaviors, I saw as well, right?
Exactly. And I can tell you that we are having a whole bunch of behavioral investigations going on regarding physical activity literacy, regarding food literacy, regarding health literacy, and regarding nature literacy. So these, and then social capital. And these are methods that we are using with validated and context-specific tools that we are applying at the moment. I showed you some examples from our social capital tool, but we are also up running with the other tools that I'm mentioning. Yeah. So in the future we will be able to show also what the impact is on these different kind of literacy tools for knowledge, behaviors, and perception. Yeah.
Well, that's great. And literacy is such an important, vital kind of antecedent to the actual behaviors, right? So, and it's a nice thing you can measure as a predictor of, how well people are, how likely people are going to engage in those healthy behaviors. There's a couple of other questions that I'll read to you. So the first one is, did you experience any resistance or barriers to creating and implementing such a beneficial intervention from the community or other stakeholders involved? And if so, how did you navigate that resistance?
Yeah, absolutely, and it does require a lot of navigation. And the main challenge, we've been lying flat down when we entered the community. We came from different rural communities in the past, before 2015, where we developed a supersetting model. And we had quite some success in these rural communities. So the question we asked was, can we also engage in a much more diverse and complex community and achieve the same kind of results? And therefore, there was only one community to go for, which is the most problematic and challenged community in Denmark, which is Tingbjerg. This is the place where there used to be a lot of gang problems and shootings and violence and so forth, and crime of all kinds. So we said if we need to go into that community and see if we can also apply the supersetting model there, because if we can do that, then at least we are covering all kinds of situations in Denmark, and then we will move abroad afterwards, which we actually do now. So what we did in those days in 2015 was that we lied them flat and went first to the social housing associations to ask if they could use our competences. And we told them who we were and what we were doing. And this was a very, very slow process of building a relationship with the social housing associations. And then one partner took the other, and all of a sudden we became, slowly, we became an integrated part of the community as a professional stakeholder, like any other professional stakeholder. And that's where we would like to be, and that's what we do. So as far as engaging or establishing ourselves in the community, it has been a long haul, which is fine. That we knew that didn't come as a surprise. But what has been more challenging, I think, over the past years is to communicate and organize evaluation investigations of various kinds. And because there is a tendency in this community being so challenged that they feel that they are exposed to the Danish medias, and that they are sort of resistant and reluctant to engage in any kind of activity that is not really within the interest of residents or professional stakeholders living or operating there. And the research agenda has never been very sexy to citizens in Danish communities. There is a lot of resistance there. So what we have said is that we are not coming with any predefined research agendas or evaluation agendas. All our research and evaluation agendas will originate from dialogue and discussion with stakeholders and with partners, and to be worked and developed together with citizens that are involved sort of or targeted by the evaluation itself. And that's why we have this third phase of co-evaluating interventions that comes from this notion that if we don't do it this way, then we will probably see, and we've seen it, we will see resistance. And therefore we have to navigate very, very carefully before introducing that agenda of research and evaluation. And we know now, I mean, now we've been there many years, so we know how to deal with this carefully and respectfully. But in the beginning, we had some challenges.
Yeah, and it was interesting how you made a point of saying that even your surveys were co-created by the citizens, so that they would feel like, you know, maybe that the research is created by them, right? Everything's created by them to kind of get them engaged. Yeah.
We have provided research capacity strengthening of citizens who were interested in learning what research is about. We've trained them, mainly youth, young people interested in research. We've trained them, and then subsequently they've been involved in designing surveys together with us as researchers in the community, and have done all the different phases of a research process. So this is kind of a way to limit resistance and to cut away poor confidence in people like us coming from us.
Yeah. Thank you for that. The other question is maybe related to what you were just talking about, is from a practical perspective, can you tell us any strategies that you use to kind of go from ideas that come from the community into more sort of rigorous implementation plans? You know, so how do you interface with the community to help bring their ideas into something that can be implemented?
You know, we used to do different kinds of design-based thinking approaches and so forth in order to have structure around the process of defining new projects and so forth. But we soon came to a conclusion that this would be highly improper. There is a lot of power imbalance when you bring a technique into a community. This in itself is a power imbalance, and then you are sitting in a powerful position, and we don't want to do that. So instead of and that's what I also try to explain in the presentation, that instead of taking specific techniques out of the drawer and apply them in this disadvantaged community, we soon came to a realization that we should rather just be there, we should be visible, and we should be sincere and respectful towards citizens. And that in that being there, dialogue with ordinary citizens was established. And you know, it's not only what we did, us from Steno and my team. I think more importantly, it is what our partners are doing and have been doing for years in the community, namely trying to and successfully grasping what the challenges of the communities are and what the needs and aspirations of citizens are. And this has been discussed very informally, and that's always the way it is. We discuss it very informally. We have different projects. Steno has different project coordinators for different projects out there, and you know, so they're present and visible in the community. And the dialogue is established between the different partner representatives in the community, the citizens who have something on their heart that they want to convey and work with, and then Steno coordinators operating there. A good example is the community gardens, which have been very, very popular, and has been an initiative that was quickly realized as useful and important, and which we took up very soon and supported and worked with our partners and those dedicated citizens to frame it around the project. And then on that basis, and that's quite important, we go into a funding mode. You know, some of these projects are heavily funded by philanthropic funding organizations in Denmark, and others are not funded at all. We just use the resources that we can put together. Like, for instance, our bee group. We have a group that have bees and produce honey in the community garden, just as an example. And this is not very expensive, and we can quickly pool our funds together and then buy these beehives and bees and so forth, and then it's up running. But for some of the projects, they are much more costly. And then it is typically, not always, but typically Steno who goes into a funding process together with partners, but where we are the pen writers. We are the ones who are writing the applications because we have experience in that. And this is where we get heavy funding into the community. Whereas for minor projects here and there, it's basically what the different partners they can bring up and put into the pot that then makes these small-scale projects running, which is what we've seen over the years, that at times we've had very heavily funded projects, and at other times we have not had any significant funding, but we are all still there. And that was my key message about this issue of sustainability, that sustainability, we've learned, is not about money. It is about trust and partnership. And we are very serious about that. And we're going to publish on that as well, because it's so important that, that we can contribute to the scientific discussion about sustainability, also the popular discussion about sustainability, which very often ends in a discussion about where to get funding. And this is a non-productive discussion if it goes in that direction. It is much more productive to discuss trusting partnerships and relation building with professional stakeholders and citizens in the communities.
Right. So it sounds like those partnerships are your vehicle to whatever resources are needed, and then and it's actually probably through the partnerships that the funding is. You serve as maybe a facilitator for those requests, but even then, yeah, no, I wonder about that in terms of like how funding sources are identified, for those sustainability plans. But I guess it's probably highly dependent on the project and the partnerships, right? And existing relationships, right, with different potential funders.
Yeah, because the different partners have different sort of approaches and connections to different funding agencies. And they I presume it's the same in Canada, that there are numerous different kind of avenues you can follow, you can go to seek funding. And from Steno's side, we are very good at connecting to a segment of the funding agencies in Denmark. But our other partners, they have connections to other sort of segments of the funding opportunities. So we get our resources from different sides and angles, but the very heavy funding that comes through us, because this is where we are well connected. Yeah. Like the Novo Nordisk Foundation, for instance, that can give us lots of money when we are applying in a proper right way. So I think we are advantaged there, that we have good connections to, for instance, the Novo Nordisk Foundation. Yeah.
And certainly for those, those initial pilot phases to demonstrate your feasibility and your benefits, right? So that you can create that business case. This has been really, really interesting and enlightening and inspiring. I'm just checking if anyone else has any questions for Paul. Please raise your hand, put it in the chat, just shout it out. I know everybody's camera is off, but they're all here. I know they are. Any questions from the audience?
I think in the meantime, I can say that that's another thing that we have come to realize over the years, that working in this way, where you are establishing a strategic partnership in a community rather than projects, but really a long-term strategic partnerships with formalized commitments in the long run. And then what you do over time is that you build up a narrative. And that narrative is based on all the experience that you generate and accumulate in the community. And the significance of this we've learned is that, that this narrative becomes more and more dispersed and widely seen in the various segments of society. That includes at the political levels, at the funding levels, at the academic levels, and in other communities, but also internationally, where we have been successful with communicating our messages in various networks and fora, and where we are now working together with cities elsewhere outside Denmark to engage in collaboration where there is a win-win situation and where we're trying to find out what our experiences can do to contribute to other local community projects elsewhere, and where their engagement and activities can contribute to ours. So the strength is that this narrative becomes stronger and stronger, and this means that we are getting into better and better positions to attract funding for our activities, but also to attract partnerships around the world. And this is pretty nice and something that we are very, very happy.
Yeah. So yeah, you're sort of building on early successes and not just early successes, but early engagement and early empowerment. No, that's great. I'm not seeing any other questions, but maybe I will take the prerogative and ask you one last question. You mentioned that Tingbjerg, sorry, I keep mispronouncing it, I'm sure, had relatively higher crime rates and gang activity. Has that changed with your intervention?
Substantially. Again, what is the cause of that? And there has been a lot of police activities, and there is a partnership as well. We're not part of that partnership. There's a partnership on security, a security partnership where the school system and social departments, various departments in the municipality, and police forces and so forth join hands, and they're also having funding for different activities. So this is one of the partnerships in Tingbjerg that Steno is not part of it, but through all the different partnerships we've established, we are still there somehow, because all our friends, they are part of this security partnership. And I think they should have a lot of credit for reductions in crime rates in the community. And it has come down a lot statistically. I mean, and there's a lot of evidence for that. The unfortunate thing is that in the mindset of residents of the community, it hasn't changed a lot. There is still a lot of anxiety about living in the community, especially leaving their flats in dark, and this prevails despite the fact, and that is really a fact, that that crime has gone down dramatically. When we came in 2015, there was still a lot of shooting in the streets, and it was very troublesome and very unpleasant. But that has ended, and we don't see that anymore now. So I'm not saying that this is because of our involvement. Of course, it's not. But it's because of everyone's involvement, and that's the whole point. This is not about Steno. This is about the community, and Steno is just contributing to a positive and important trend or development in the community. And we are very proud of being part of that development of the community. It has nothing to do with Steno. It has a lot to do with community development.
Well, that's a wonderful way to end, Paul. Thank you so much for an inspiring presentation and giving time as well for a really great discussion. I want to ask everyone to join me in thanking Paul for this talk today, and thank you all for joining. We have posted in the chat the link to today's evaluation. Please fill it out. We're always looking to get your feedback on our seminar series. We will also send it by email, and just to let us know that we are taking a hiatus from our seminar series over the summer months, and our next seminar will be held on Monday, September 18th. From 12 to 1, where we have one of our own faculty, Dr. Arjaman Siddiqui, who will be presenting. We hope to see you all there, and please visit our website for further information, or if you'd like to review Paul Bloch's talk. And thank you very much, everyone. Have a wonderful summer, and thank you again, Paul, for joining us today, all the way from Copenhagen.
Thank you so much. It was a pleasure. Thanks a lot.
Thank you. Bye-bye.
Bye.